With this week's Cardiology Countdown, we have a look at biomarkers to detect cardiomyopathy and prognosis, and also early cardiomyopathy following chemotherapy. Also a look at CMR in detecting early cardiomyopathy, and a look at CT angiography in a randomized trial. So beginning at the number 3 spot, we have a study published in JAMA that has 13-year follow-up in a cohort of elderly patients with heart failure symptoms who had all the routine evaluations, but also had NT-proBNP and a new biomarker copeptin measured at baseline. They found that both the NT-proBNP, not surprisingly, but also this vasopressin-related marker copeptin could predict mortality, and the combination had a very strong association and could improve risk stratification overall. And so this may be a new biomarker to help risk stratify heart failure patients. Now, the second study looked at biomarkers and CMR at evaluating cardiomyopathy in patients who are getting adjuvant chemotherapy for breast cancer. This was a study looking at trastuzumab for HER-positive breast cancer, where it's known that a large percentage of patients will develop cardiomyopathy. In this series of 42 patients, actually 10 patients developed cardiomyopathy after therapy with trastuzumab. And so they looked serially with biomarkers and also strain and tissue velocity imaging with CMR to see whether one could detect the subsequent cardiomyopathy earlier. Now, the biomarkers had some association, but it was a modest number of events, and so did not reach any statistical significance. But the CMR was able to, after just 90 days of therapy, detect early changes that ultimately went on to correlate very strongly with developing cardiomyopathy and LV dysfunction. And so this is an initial study that's very suggestive that CMR could be a very sensitive way of tracking patients and early detection of cardiomyopathy. And all the details are published in JACC this week. And then the final study is a randomized trial looking at low-risk patients and using coronary CT angiography to try and further risk stratify them. It was a study done in Korea, about 1,000 patients in each group. They were randomized to either having coronary calcium scoring done or not, and following standard care. What was seen is that of the roughly third of patients who tested positive for stenoses on the CT angiography had about a 3 or 4 times higher rate of use of statins and aspirin in the physicians who knew that information as compared with those who did not. Interestingly, also in the early days, in the first 3 months after knowing the CT angiographic results, 13 versus 1 patient underwent revascularization. Then when they looked at outcomes through 1 year, just 1 patient in each group had a cardiovascular death or MI. And so they argued that while the CT angiography was helpful in beginning preventive therapies, they didn't see much of a difference in actual outcomes. Now, one question I had looking at this is whether the early revascularization may have helped contribute, but certainly in a low-risk population, just 18 months of follow-up will be very hard to see a benefit of that added use of preventive therapies. And so a note of caution before adopting an expensive screening tool that one would want to ideally see outcomes that are improved. So with this week's Cardiology Countdown, I'm Chris Cannon.